These are the doctors and nurses at the front line. The second wave is here. Spain's capital, Madrid, is Europe's new coronavirus hotspot, but medical staff say they're ready.
It's true, we've sharpened our treatment. We have more experience in what to do and when to do it. We're getting patients into intensive care as soon as possible. And if need be, we're putting them on ventilators earlier than usual.
There's some good news. The speed of new infections in Spain is waning. But that could change. Whatever the case, Madrid is back under lockdown. A great deal of Europe is reintroducing restrictions as infections spike. Berlin is imposing a curfew from Saturday. Parts of the city are now hotspots. In Germany, daily coronavirus cases have hit a new high since April. Rising hospital rates have health officials worried in the UK. The government's reviewing measures. In Iceland, pubs, clubs and arcade halls and gyms are closed. There are fears the latest wave of infections could be much higher than the first. And Paris has shut its bars, but there's resistance.
This is pathetic. When you look at what's happening with public transport, people are crammed together in metros and buses. I think it's stupid. It's a political issue. The government is constantly manipulating people left, right, and center with economic interests.
Running an economy and keeping a pandemic at bay is a balancing act. So far, the virus hasn't overwhelmed Germany's hospitals, but they're in a better position to tackle this second wave.
Bruno Tegel had just started working here at the Helios clinic in Berlin when the coronavirus pandemic reached Germany. The young assistant doctor is still impressed by just how quickly the hospital reacted in March. For example, we reallocated parts of the central surgery room to be used as a new intensive care unit within 24 hours. Along with that, entire coronavirus treatment centres were set up in Berlin. Equipment was scarce, and management were worried there weren't enough ventilators. Many hospitals had to improvise. The first wave of infection took the Helios clinic by surprise. As far as testing capacities are concerned, in terms of masks and protective clothing, we are prepared. We know where and when to hospitalise patients. We can make quick diagnoses and quick decisions. Everyone who arrives at the hospital is tested for coronavirus before they're admitted, and patients are strictly separated. Those who test negative go to the green ward, those who test positive go to the red ward, and suspected cases go to the yellow ward. Bruno Tegel feels this system is safe. We haven't seen a single case of patients infecting staff since these measures were initiated. Now, treating coronavirus patients has become routine. The applause once heard from German balconies has quietened down. People seem to have forgotten the significance of healthcare workers. That so many coronavirus deniers have taken to the streets in recent weeks is something nurses and doctors struggle to understand. Some people say, I've never seen coronavirus, so I don't believe in it. Well, I've never seen electricity, but I don't put my finger in the socket. We've seen coronavirus here. We've seen deaths. Bruno Tegel has also seen the effects of the coronavirus firsthand, but he knows that his hospital is well prepared for what the pandemic might bring.
Well, Monica Gandhi is an infectious disease doctor and researcher with the University of California, San Francisco. Monica, great to have you on the show. What do the rising rates, new lockdowns and latest preparations all tell you?
You know, we are either in a second wave or more likely the continuation of our first wave. And unfortunately, we haven't gotten on top of this COVID pandemic. The cases are still rising, and they've been rising in Germany and throughout the United States and in Europe. However, death rates are staying lower than they were during the first wave.
Why do you call lockdowns, though, a blunt instrument in the fight against the coronavirus?
Because lockdowns are extremely disruptive to the economy, to the poor, to workers, to so many aspects of other aspects of public health. And there are other ways that we can stay safe from infection. And those pillars of pandemic control are essentially social distancing, wearing masks, hand hygiene, ventilation, doing things outside when we can, and staying away from large crowds. But complete lockdowns are a completely blunt instrument that have affected aspects of public health that we're going to have ramifications for so long.
Talking about crowds, we've seen huge protests also here in Berlin against these lockdowns. I mean, are they justified, or is it quite counterproductive, considering these people are all coming together and mainly not wearing masks?
So it's completely counterproductive to be in large crowds without masks. So there is absolute full acknowledgement of the seriousness of this disease. And we have to completely change life as we know it. Wearing masks is unusual. Complete social distancing is unusual. Not having large crowds is different. Having settings where we are keeping to small cohorts of groups, doing things outside, keeping things ventilated, all of this is different. Life is different. But it is risky to be in large crowds without masks in the setting of a pandemic.
I was also just talking to friends in Sweden. They're not wearing masks. The bars are full. Why are they so relaxed?
You know, Sweden is a very interesting case that will be looked at for years and decades to understand what happened. There is social distancing at the beginning. There was sort of a recommendation to the public to stay away from each other. There were a lot of deaths at the beginning, very unfortunately, because a lot of the vulnerable older people in nursing homes died. And whether there is more immunity in the population is being speculated. I think that's likely true. They do stay away from each other in general, but you're right. Things are much more normal in Sweden. They took a different strategy. They are in a different place, but it was at high expense at the beginning.
In an interview, you said how much virus you breathe in is probably one of the most important determinants of how sick you get. Do you still stand by that?
Yes, you know, we and others have been looking at that question of the viral dose or the viral inoculum. The amount that you get in is proportional to how sick you get. And we've not only been looking at this with coronavirus, this has actually been shown in measles, dengue, salmonella, many other infectious diseases. We're putting together a review paper on this now. But the main thing is that if this is true with coronavirus, social distancing and wearing that mask reduces the amount of virus you get in and the likelihood that you're going to become ill. And this seems to make sense in animal models and what we've been seeing with this virus, including decreasing mortality in places that are consistent with facial masking.
Monica, two quick questions for you. What do you think about your president's message that he's sending to the rest of the world?
I think President Trump's message is dangerous and ridiculous, and he has been flouted almost all public health recommendations except for testing. He doesn't mask, he doesn't socially distance, he keeps large crowds, he doesn't contact trace in the case of this disaster, he didn't isolate, he didn't encourage quarantining, he just tested. That is only one strategy of the pandemic, and it's not enough.
And lastly, if you can sum it up in one word, what's going to end this pandemic?
You know, it is not being normal for at least a year plus the vaccine on top of it. So it is wearing masks, staying away from each other, hand washing, and then waiting for that safe and effective vaccine, but not completely shutting down society.
You heard it from Monica Gandhi. Thank you very much for being on the show today.
Thank you.
And now it's Derek Williams' chance to answer your questions on the coronavirus. If you want us to look into something in particular, just write to us on our YouTube channel.
If I've recovered from COVID-19, do I still have to wear a mask?
Sometimes it's easy to forget that millions and millions of people worldwide have also recovered from COVID-19 and want to return as much as possible to life as usual. But what does coming out the other end mean? Are you safe from the disease because you're immune? Can you still pose a potential danger to others? Do you need to continue to social distance and wear a mask? It's all questions that we still don't have firm answers to. We just have to guess and rely on what we know from other infectious diseases, particularly those caused by other coronaviruses. Based on what we've seen so far with COVID-19, people do acquire some immunity. The problem is we don't know for how long on average. What we do know is that with other coronaviruses that infect humans, immunity can wane pretty swiftly. There are a number of studies that convincingly show that people can be reinfected with some of them within a year. And there have been a few isolated documented cases of that also happening with COVID-19. Also, at least in some of those cases, the people who were reinfected showed no symptoms the second time around. So were they infectious to others? We don't know. And to me, it seems like, in general, that until we have better data, when it comes to questions that we have to answer with, we don't know, we should be erring on the side of caution. So in the face of this particular we don't know, I'd go for the fallback position, which is to continue to assume that masking up is a way to protect yourself and others, even if you've recovered from COVID-19.